So this is not a full dry needling course. Some considerations for the cervical spine. A lot of times people were taught to use gloves. As you can see, I don't. I do ask them if they've had any blood issues, hepatitis or HIV. Acupuncturists don't use gloves. Not that I'm an acupuncturist, but these are the same needles. For upper trap, I'll be right there. Should I be over on this side so you can see better? Right there. Just want to make sure I'm going away from the lungs. So I'm going to be going a little cranially there. And I can spin it to manipulate it, or I can go in and out to piston, or I can pull out a little bit and redirect to fan. Those are all options. You can see it twitch a little bit there. I do not leave these in, pull it out there. Drop his face just a little bit here. I like getting the occiput as a backdrop. Want to make sure I'm not going towards the foramen magnum. I would have to angle more medially and anteriorly to do that. Marianne, could you grab the phone and face it this way? So that way they can see that one better. I'll probably have to take it out. So,
where are we?
here's the needle there. See if they can see that one better. And then I'm going to do one. So there's C2. There's the occiput. So I want to be above C2, going straight down. I do not think in terms of muscles. I don't think normally muscles have a problem. Muscles can be painful, but they're typically not the root. So I want to be, I think, more cervical levels. However, this one up here, you could argue it's occipital nerve near there, but also it's just a great one for headaches. But I don't think, okay, this one is rectus capitis posterior major, this one posterior minor, anything like that. I think about, so I did one at the occiput, C1, C2. Am I going to get most of the suboccipitals with this? Sure am. These are 25s. You can go 40s, sometimes even 50s. 50s, they would have to have a pretty thick neck. Typical Aaron, a little shorter than deep. I can do that all the way down. Right at the crease, typically that 5-6 is where the biggest crease is. You know, if here's 7, here's 6. I'm going to be going straight down right there. And I'm next to the spinous process, but I don't want to be on it. Again, it's hard to be dangerous in this area unless you go really too deep and you can slide between them. And then I can, a lot of times I'll just do unilateral manipulation with all these. A lot of times I'll get them in and I'll unilaterally manipulate them all before I add any yeast into them, and I let them sit there for a while.